A year after the pandemic began, finally, the focus shifts towards recovery. Which priorities should we address first? And how long should we expect this journey to take? Tonight, Governor Tate Reeves and a panel of experts address your questions. Live from the WJTV 12 News Studios in Jackson, Mississippi, this is a Mississippi Town Hall, the road to normal. Hello and welcome to our viewers around the state, and welcome to Governor Reeves and his advisors here in Studio B. We have State Health Officer Dr. Thomas Dobbs, who leads Mississippi's Department of Health, and Lieutenant Colonel Stephen McCraney, retired National Guard, now leading the Mississippi Emergency Management Agency. I'm Byron Brown, standing by with our guests and your questions.
And I'm Melanie Christopher. Over the next hour, we'll present those questions for the Reeves administration on its response to the COVID-19 pandemic. We are broadcasting to every corner of the state tonight. We're live on Nexstar Media Group stations in Jackson, Hattiesburg, and Memphis, as well as partner stations in Meridian, Gulfport, and in Baton Rouge, Louisiana. Our thanks to them for making this important broadcast possible. The COVID-19 pandemic and economic recovery is the focus for tonight's town hall. But remember, this is your town hall. You can send your questions for the governor, Dr. Dobbs, and Colonel McCraney by email. The address is townhall@wjtv.com. There are contact links on our website and mobile app, and you can flag a question for us on social media with the hashtag #AskReeves. And we'll use our 12 News Connect feature to gauge your views on the state's response to the pandemic. You can cast your vote right now. Do you approve of the state's response to the COVID-19 emergency under Governor Tate Reeves' leadership? Find our informal web poll, 12 News Connect. It's in the menu on our mobile app. It's also on our website, wjtv.com/connect. Now, I'll be here at the news desk watching for your questions and feedback. Now, let's send it over to Byron and our panel.
All right, thank you, Melanie. Well, despite substantial declines in infection and morbidity rates from COVID, we are still in a pandemic in Mississippi and around the world. Here in our studios tonight, we are observing state and federal guidelines for limiting the spread of the coronavirus. And many of us, guests and news staff alike, are either fully vaccinated against COVID-19 or in the process of vaccinating. We are going to lead off the program with some news that broke today. The FDA and the CDC are recommending a pause in using the single-dose Johnson & Johnson COVID-19 vaccine. They are investigating reports of potentially dangerous blood clots. Now, more than 6.8 million doses of the J&J vaccine have been given in the U.S. Our question to you, Governor, how concerned are you about this development, and how might it impact the vaccination effort here in the state of Mississippi?
Well, first of all, Byron, thank you for having me on. It really is a privilege to be on statewide TV to talk about these issues that are very, very important. And where we find ourselves in the pandemic today is one in which talking about the overall issue of vaccine hesitancy is extremely important. We have seen 1.5 million shots delivered in our state thus far. But as we try to get that next 100,000 individuals and that next 100,000, we know that we've got to continue to educate the public, and you giving us this opportunity today, I sincerely appreciate it. I'm going to let Dr. Dobbs talk about the specifics as it relates to Johnson & Johnson. My understanding is that that particular vaccine has been delivered approximately 6.8 million doses, and to date there have been approximately 6 individual females that have had an adverse reaction to it. Blood clots. Clearly, when you are in the process of doing what we're doing, which is mass vaccinations across America, we're well over 100 million doses across the United States. And in our state, as I mentioned earlier, we're at 1.5 million doses just in our state alone. It certainly stands to reason that if you have some individuals that are concerned about these outcomes, that you take a pause, you take a look at it, you look at the data, you look at the science, and then ultimately make decisions as it relates to that. And I think certainly the decision to take a pause on that particular vaccine is prudent, again, because we want to make sure that this is a safe opportunity for all Americans.
Dr. Dobbs, how much do you think this trouble with the Johnson & Johnson single-dose shot will impact vaccine hesitancy?
We need to be very cautious about it. It's a real concern because faith and trust is such an important part of this pandemic response, especially with the vaccination piece. I would like to reiterate how, this has been a very rare thing, that in the United States we've given over 6.8 million of these shots, and we've seen in 6 of these cases. So it's exceedingly rare. And if we think about the number of people who've died from COVID, over 500,000 Americans have died from COVID. And if you look at the risk, if let's do a comparison of risk, if you're over 65 and diagnosed with coronavirus in Mississippi, your chance of death is 1 in 10 versus 1 in a million, right? And if you look at, if you're age 50 to 64, your chance is 2 in 100 compared to 1 in a million. And that's cases, not deaths. Only 1 of the 6 unfortunate young women has died. So it is a serious condition. We need to take it very seriously. We need to make sure that the FDA and CDC have an opportunity to do their analysis and find out, are there certain people who are better to not get this vaccine? And I think that's probably where we're going, but it's something that we want to be ahead of and make sure that we are ultra efficient at communicating with the public so that they know where the truth stands.
Let's talk more about the vaccination. Governor Reeves, how is the vaccine drive going at this point in the pandemic here in the state?
Well, I'll just reiterate something Dr. Dobbs said, and that's transparency is critical. We have been exceptionally transparent throughout this process. We've tried to go on statewide TV. We've used social media platforms. We have actually benefited from the press in our state in terms of getting out information, and we believe from the beginning, if we told the people of Mississippi the truth, that they would make wise decisions, and that's what we've tried to do throughout this process. I think when you talk to the individuals that have had the opportunity to get the vaccine, particularly those individuals that have gone through our state-run mass vaccination sites, those are partnerships between the Mississippi State Department of Health, the Mississippi Emergency Management Agency, and they are manned by individuals from both of those agencies, but also, as you can see when you drive up, a lot of Mississippi National Guard troops are there as well to help with logistics, to help actually provide the shots. And so I couldn't be more pleased with the efforts of all of those individuals that have worked around the state to make that happen. But the thing that we noticed very early on, Byron, and this is, I think, something that both of these gentlemen that are sitting with me today should be commended on. They've both done a fantastic job throughout this entire process. But when you talk about the vaccines, clearly in January, February, and March, we had a situation in which the demand for the vaccine was significantly greater than the supply that we had. So for us to be most efficient, we could have sent all of those vaccines to the mass vac sites, and we could have gotten them in arms at a pace probably that was a little bit quicker. But what we realized very early on is as you get to 1.5 million shots in arms, which is where we are today, we've got to make sure we have a delivery system in place such that it is easy for individuals to get it. In many instances, driving to our mass vaccination sites is not easy for a lot of people. But if you have over 400 partners that are delivering shots across the state, and you have partners in every single county that are delivering shots, which is the type of delivery system and delivery mechanism that we have built, then it makes it that much easier for individuals. And so what I envision now is we have approximately 893,000 Mississippians that have gotten their first dose. As we get to 1 million and push to 1.1 million, and as we get to 1.1 million and push to 1.2 million, it's got to be easy for our fellow Mississippians. How do you make it easy? Well, you have it in places that those individuals are going to anyway. So you have it in pharmacies. You have it in Walmarts. You have it in their primary care physicians' offices. So maybe they're going there because they have allergies, and their primary care physician says, hey, since you're here, how would you like to go ahead and get vaccinated for the coronavirus? And a lot of individuals will say, okay, I may not be willing to go out of my way to get vaccinated, but if I'm here at my doctor's office or I'm here at my pharmacist and these professionals that I trust suggest to me that maybe I should get it, then maybe that helps us get more shots in arms. And at the end of the day, that's where we find ourselves in this pandemic. We are not at the end of the road, but we can see the end of the road. But the only way we can get from here to there is for more and more of our fellow Mississippians to get vaccinated to protect against the virus, understanding the risk. But again, we want to protect ourselves and protect our neighbors, and that's where we find ourselves.
Dr. Dobbs and Governor, you each disputed some of the data reported on vaccinations per capita or suggested that some of the numbers have been taken out of context. We've crunched those numbers provided by your state health department. We found that just about 577,000 Mississippians have been fully vaccinated, not counting those vaccinated by federal agencies. That number is less than 20% of the state's population of 2.9 million. By that measure, we rank 45th out of 50 states in vaccinations per capita. Governor, is that an acceptable performance level of vaccination efforts?
Well, what I would tell you is that something that you said that I think is very important, Byron, is not including those Mississippians vaccinated by federal agencies. I think if you're going to look at total vaccinations, you ought to look at total vaccinations. And so far in Mississippi, we've fully vaccinated about 635,000 Mississippians. That's through close of business yesterday. We've had 893,000 Mississippians have gotten at least their first shot. And so when you look at things, and I'll give you an example, when you start comparing from state to state, there's a couple of things that I think are important. Number one, the difference in being 20th and 40th is literally 1 or 2% of the population. It is literally a day or two of actual shots, because we went literally 90 to 100 days when every state, by and large, was putting 100% of their shots in arms on a weekly basis. And so there's a very little difference between being 20th and 40th. The other thing I would tell you is when you look at the vaccine hesitancy, that's certainly something that we're beginning to experience more and more of. We went literally until basically the end of March where supply was far below demand. Well, now we find ourselves in a position where demand, or at least supply, has caught up with demand and maybe even surpassed it to a certain extent. The other thing I would mention with respect to state rankings is, and we've talked a lot about this, and I'm sure Dr. Dobbs will spend a good bit of time doing that. One of the things Mississippi's done exceptionally well is ensured that we had an equitable distribution and equitable access to the vaccine across geographic regions, across races, across the board. And the fact is that when you focus a little bit of time on that, it takes away a little bit of time from an efficiency standpoint. It's just a natural progress. But here's what's important. At the end of the day, getting shots in arms is going to help us get to the end of the road. But what's really important when you're looking at the data and you're looking at the numbers is how have all of the things that you've enacted, whether it's mask or it's vaccines, how have all of those things that you have enacted to deal with the spread of the coronavirus, what are the bottom lines in terms of total number of cases? What is the bottom line in terms of total number of hospitalizations? What's the bottom line in terms of those patients that are in ICU beds? And then ultimately, what is the bottom line in terms of the worst outcome, which is fatalities? And if you look at our data in Mississippi, at our peak, we had 1,444 Mississippians in hospital beds because of the coronavirus. Today, that number is down to 170. At our peak, we had 370 Mississippians that were in ICU beds with the coronavirus. Today, that number is down to 70. You look at the number of Mississippians that are on ventilators, well over 200 at our peak, now well below 40. So again, we're 80 to 95% below our peak levels. Our numbers have plummeted, and that's something that I've got to give credit to not only the state agencies and the individuals that have worked hard to make that happen. I've got to give credit to the people of Mississippi because they've made good, wise, smart decisions. A large number of them have gotten vaccines, or a large number of them continue to protect themselves and protect their families when they need to. And so, again, I think it's been a joint effort, and it's an effort that I'm very proud of.
Yeah, here's another data point that we found in our research. Of the 1.4 million doses of vaccines administered in the state, about 435,000 have gone to black Mississippians. That's 32% of the total, and it's a big improvement from the first few weeks of the vaccination campaign. This tracks much closer to African Americans' share of the state's population. And the Kaiser Family Foundation found last week that Mississippi and the District of Columbia lead the nation in terms of vaccine acceptance among African Americans. There's more. It appears the bulk of current vaccinations are happening in more urban areas of the state, judging from doses administered by county. Rural counties tend to see relatively low numbers. So, Dr. Dobbs, what demographic challenges do you reasonably expect to face as you try to get hundreds of thousands of more doses into Mississippians?
Yeah, so rurality is always a challenge. There's just no doubt about it. And certainly we've been looking at that from day one, trying to make sure that we had partners in locations where rural folks lived. But even in rural folks, there aren't clinics. There aren't doctors necessarily. And so your infrastructure doesn't exist there as it is. So it is a challenge. There's just no doubt about it. I think we need to think about this in the totality of how do we go from where we've been to where we want to go as a healthy state. There's a lot in there. But I'd like to say, you know, the rural counties are not necessarily doing that badly. Jefferson County has one of the highest immunization rates in the state, right? And it is a rural county. Bolivar County is doing great. A lot of our places are doing great, and a lot of that depends upon the successes we've had with our partnerships. We know that the two leading health disparities in our country are number one, being African American, and number two, being rural. So we've got a lot of challenges there. But this is a good springboard. We can use our successes and the things we've learned from this event to push us to the next phase for the other challenges we're going to have, whether it's chronic disease, you know, diabetes, et cetera. So I think it's encouraging. I think our rural strategy has been mostly successful, but we're not satisfied. We've got a long way to go, and we've got some exciting ideas to take us there.
What is Jefferson County doing right?
Well, you know, I'll have to say a lot of us are the partners. A lot of folks went to Adams County, because Adams County is pretty close, and we had a really robust clinic there. But the hospital there was great. Jefferson Comp was a great partner. We have been very well intertwined with our community health center partners from the very beginning, recognizing the true value that they bring to health for the state, you know, in so many ways. They help rural communities. Early on, when we were looking at our analysis of where is vaccine going, community health centers were given 71% of their vaccine was going to African Americans, and a lot of those were in rural areas. So we almost had this sort of survival of the fittest approach to try to make sure we got vaccines where there was success. And so we steered vaccines to clinics that were being successful, that were using it quickly, that were getting to our priority populations. And I would just like to say thank you to our community health center partners, because I think between you and the leaders in the black community, a lot of our success, and really the vast majority of it, you know, sits with those guys.
Director McCraney, what role can the National Guard, they've done a great job in the urban areas, what role can they play in helping the rural areas?
I think when you look at the makeup of the National Guard, they are from small town Mississippi. I was born and raised in Edwards, a very small town, and their interaction, the trust there of those soldiers and those airmen with being involved in their local community. They are citizen soldiers. They're not coming from somewhere else. They are right here from Mississippi, and I've gotten report after report from individuals sending emails saying how great the process was. They trusted that National Guardsman when they pulled up in, because they are normally the ones that really are a huge arm for us at MEMA during any natural disaster, any disaster and pandemic. They have been a great front line for the Department of Health and myself as well.
Is there now another plan to get more National Guard into rural communities to give shots in arms? The
Adjutant General said he's definitely open to it. We still have ability to bring on more National Guardsmen if we need to, and that's a phased approach, and that's what Dr. Dobbs and myself and the governor, we sat down and we said, what phase we're ready to move to next? Do we have the vaccine on hand that we can do that, to be able to stay on that pace? So I think we're there.
Byron, if I may, I just want to point out that when you look at the divide of what we see in terms of vaccination rates around our state, and it's true around the country, it's really not Republican versus Democrat. It's not really black versus white. It's truly urban versus rural in terms of really not only the total numbers, but also their desire to get the vaccine. That's one of the things that we have to work on. The other thing I'll just point out, when you use the statistic of 32% of all shots have gone to African Americans, that is an accurate number. But I also want to make sure everyone knows that there's a small sliver, 5, 6, 7% of all vaccines that are delivered that we don't have a race for. And so if you look at just those shots that have been given based upon the data that is fully based upon race, about 35% of all of our shots have gone to African Americans, which is even closer to the actual population. And so I'm proud of Dr. Dobbs and his team and everyone else at making it a priority to get these shots in arms.
Governor, that brings us to another question that we have from a viewer. Martha H. said, why did he say on TV that black people in Mississippi needed to be educated about taking the COVID vaccine? You said that on Good Morning America on April 4th. If the numbers in the state are going up among African Americans, what made you say that on Good Morning America?
Well, what I actually said was all Mississippians need to be educated about the virus. As I travel around Mississippi and I listen to my constituents talk I hear them regularly because, you know, there's this desire to say, who can endorse the vaccine and convince more people to take it? Whether it's, can former President Obama endorse the vaccine? Will that make more people take it? Or former President Trump, if he, and this is a question I get often, if he were to endorse the vaccine, would more people take it? And what I tried to illustrate to people is it's kind of like politics. While endorsements are important, what's even more important is education. And so as I talk to people around the state that have not yet taken a vaccine, they really want to hear about, I want to know about the specifics. I want to know about the trials. I want to know how many people were in the trials. I want to know, has these trials been significantly different than, say, trials for other vaccines or trials for other medicines that we take? And so it's truly an education process. And you may have seen last week, Dr. Dobbs and I got together and put a couple of additional physicians, one a heart doc, Dr. Hayes, another an OBGYN, and really got down into the specifics of the things that were going on and trying to debunk some of the myths. And so I think that education piece is really about educating people across the state and across America, but particularly people in rural parts of our state who clearly are a little bit more hesitant than those in the more urban areas. Is it still about education, or is it more about access, Dr. Dobbs?
You know, they're both there. And I think early on, probably, and trust. Some of it's not just education, it's also trust. And I think for some subsets of the population, that's a huge issue. And I'll tell you over and over again, when we've engaged with folks, no matter who it is, when we gave people an opportunity to ask questions, because people have concerns, everybody has different concerns, and maybe they have different belief systems about it. And once people have trust, it all seems to flow from there. And I think early on, we did have a counterbalance where the access was a bigger issue than we realized. And I think pivoting to that, and we learned that from talking to people, and said, hey, there's people in my community who want it, you just need to bring it to us. But then there's other folks who you need a little bit of convincing.
And we've been talking a lot about trust and hesitancy, and that brings us to our next question. How do you assure people that the vaccines that we have will be adequately to be able to protect them with the different strains that are out there?
Science. We got to just follow science closely. We'll try to be credible messengers and make sure people understand that, you know, when we have something, we'll be straight. And right now, the vaccines look really, really strong against the variants, especially the UK variant, which is the one that's kind of growing so quickly in the United States. The vaccines look really, really strong against those. And even the Pfizer showed that against the South African strain, 91% efficacy. If we have one that's not going to be as good, we're going to say it. We're going to talk about what do we need to do to prevent transmission of it. But we're going to just try to be straight so that people can make the right decisions.
And I think the other point with respect to efficacy, and I think this is critically important, is it's one thing to have a level that ensures an individual doesn't get the virus, and that's important. But perhaps what's even more important is how bad is the virus, even amongst those who actually get it if they have been vaccinated. And what you're finding more and more is that the likelihood of a really severe case, a likelihood of hospitalization, a likelihood of ending up in ICU beds seems to be significantly less for those individuals who have been vaccinated, even for those who still get the virus, which is a very, very small percentage, but they tend to get a much less case. And at the end of the day, that's really what we're trying to stop. I've been very clear from the beginning, Byron. My goal has never been to try to drive the number of cases down to zero, although that would be a great outcome if we got there. Our goal from the beginning has been to protect the integrity of our healthcare system and ultimately protect Mississippians by ensuring that if they could get better with quality care, that they receive that quality care. And so driving down the number of hospitalizations, driving down the number of patients in ICU beds is a major, major part of that.
All right, Melanie has been standing by with viewer questions. She has a question now for you, Governor.
Thank you very much, Byron. Yes, we have a question about the COVID-19 fatality rate in Mississippi. 7,119 people have died from the coronavirus here. And Robert D. emails this question. Mississippi is confirmed to have the 5th worst COVID-19 deaths per capita in the U.S. With excess mortality numbers taken into account, we're probably even worse off than that. Why is this the case? What does the road to normal look like for families of the 7,000 plus Mississippians we've lost? And we did check this claim against mortality data from Johns Hopkins University. And yes, Mississippi does have the 5th highest rate of COVID-19 fatalities in the nation?
Yeah, it's a great question, and let me begin by saying that my heart aches for all 7,000 plus Mississippi families that have lost a loved one because of the coronavirus. When you look at how Mississippi has compared to other states, if you look at total number of cases, Mississippi is approximately the 34th most populated state in America, and Mississippi's had approximately the 34th most total number of cases in America. And so on a per population basis, we've had approximately about exactly what you would expect in terms of total number of cases, even though we've had the 5th least restrictive policies from an economic standpoint in America. And so then the question becomes, well, if that data point is true, which it is, then why are our deaths per capita higher? And for me, and I'll let Dr. Dobbs opine on this, but for me it's a very clear answer. And it's where we as a state started from a health disparity standpoint, where we as a state started from overall health, and particularly the fact that this virus is particularly cruel, not only to those that are over the age of 65, but it's particularly cruel for those individuals who have at least one, and in many instances more than one, comorbidities, things like diabetes, things like being overweight. This particular virus is exceptionally cruel to those individuals who have that. And when you look at those statistics in Mississippi compared to other states around the nation, we tend to underperform. That is certainly not a new phenomenon. It's been something that has been the case for many, many years in our state. It's something that we've got to continue to work towards, and are committed to continuing to work towards. But I think it's more a function of where we started on overall health disparities more than anything else.
Dr. Dobbs, do you agree with this assessment? Or?
Yeah, that's certainly a factor. You know, we do lead the country in heart issues and hypertension and obesity, and we know that these are powerful risk factors for outcomes from COVID. I do hope that we can use this as an opportunity to really learn, though, because the other thing that we fought a lot was disinformation, right? And if you have people who deny COVID's real and are not willing to do simple things, because like the governor said, our state has been relatively open and we have a robust economy because of it, and tried to balance it with policies that made sense. The policies that make sense are not going to kill the economy, and if we have challenges in the future, we need to learn from that and understand that, hey, when the governor says something, he's not kidding, this is real. Or hopefully when I'm saying something, say, this is something we need to pay attention to. So, you know, this is not over. Every death, you know, it weighs on us because, you know, we always wonder, could we have done more? And I think you could see from the regular input that we all gave and the passion of our approach that this was something important to us. And I think more people would have died without the robust efforts that many have done in the state.
And so you said that some efforts should have been, the efforts that people have made should have been maybe altered or changed? Or?
Oh, yeah. Oh, definitely. You know, if you have folks who believe COVID's not real and are going to have big parties indoor and have massive outbreaks like we saw, that's a real problem. And that's not something that is, that's real. You can't cast blame on it, but we need to use our opportunity now to say, hey, look, we're in this together. And what's the one thing that we can do to really put this behind us? It's to get vaccinated. Get vaccinated right now.
All right, thank you. Of course, we're going to have much more with our town hall with the governor and his panel right after this. We're going to take a quick break, and we'll be right back with more of our town hall, A Road to Normal, right after this.